Now, again, the frustration seems to mount, and the COVID PR playbook is now being used by many a state leader, depending on where they are in the cycle, about whether they're trying to scare you, whether it's in the rearview mirror, or whether they want to distract from more serious issues that expose the failures of how slapped together some of the COVID response has been, like in Western Australia. Whereas we told you all last week, and we will continue to talk about for as long as we can, the police in Western Australia used the QR code system to get data on people that they were investigating. Do I have a problem with bad guys going to jail? No. But was this the entire reason why this system was put in place? No. Understandably and quite correctly, we were all told this is not tracking material. Yet even after the police were told in Western Australia, don't do this, they kept doing it. So now the laws are about to be changed in Western Australia. So the very same people who said trust us are now saying trust us again. Surprise, surprise, that the trust isn't there. We also learn that this was happening before the last state election, a state election that was all about the COVID response, a state election that should have had criticism of the West Australian government, because remember, ramping in hospitals was terrible, and the app that they wanted everyone to use months after it was used in places like New South Wales was also being used by the police to track people's movements. So, when bad news starts to build up, what do? Well, you consult the COVID PR playbook. And if you're a power-mad premier, what you do is you have to say, okay, so there's no cases. I can't scare you about that. There hasn't been cases here for weeks and weeks. So let's pretend things are opening up and people will be distracted. And the sycophantic media in the West, well, they lick the boots of the emperor.
Whilst over the course of the last year, we've had some of the strongest hospitality figures on record, tourism and hospitality figures on record. In fact, I think they have been the strongest growth in hospitality and tourism. There's still been the occasional lockdown and the restrictions in place.
Oh, yes, of course. But the decision today was the very slight difference between Code 4 and Code 5, which essentially means there are no COVID rules in Western Australia when it comes to density of people going in and out of pubs. Distraction. Always pay attention not to what they want you to talk about, but what we were talking about before they decided to change the subject, which is why you continue talking about the thing that they don't want you to know about. Meantime, as you remember, just a couple of weeks ago, for a couple of weeks, Melbourne was in total lockdown, regional Victoria, shut in. Kids didn't go to school for a couple of weeks, and then things got slightly better, where they told you that there was only so many Ks you could travel from your house, and then it became 25 Ks. And then they had rules where, as late as last week, there were limits on the number of little girls who could dance in dance studios, but there are 50 people who at any one time can go to a brothel. You know, follow the science. Thanks for keeping us safe. Well, while all of these rules were applying to you, guess who didn't have to worry about the travel rules? Bambi Eyes Brett Sutton. You see, he travelled out of the 5Ks, out of the 25Ks, into an entire different state when other people couldn't. Why? Because he had a really important meeting to go to. And there was an awards show as well.
We will not be open until there are no cases. We all know that. We've been told to expect lockdown to extend until the 21st of this month, which would make it, 3.5 weeks. I mean, you get lost for words.
It's not just the money. Governments think in terms of money, but mental health is a big issue. I know personally 2 franchisees lost their marriage and their home last year because of lockdown. I know others have had suicide attempts in their family. These are people I know. And the strain and the hurt that goes on, not being able to live. Even if you got paid everything, it's not the same as having a job. So it's terrible.
Oh, sorry, that's not Bambi Eyes. Those were people who were screwed over by the decisions made by Bambi Eyes, pretending the Delta Force, Chuck Norris strain of the virus was ripping through Melbourne, when of course we know it was only in the northwest, which they eventually ended up calling the west, and really was all about Whittlesea, you know that. But this bloke was able to travel, and he travelled to, as I said, a meeting of other chief medical officers to all decide which page of the Goldilocks book they were up to, and there was an awards dinner that he attended. But is he sorry? Well, here's a footballer's apology.
I went for work purposes. It's a two-day meeting of the National Health and Medical Research Council. We were all asked to attend in person if we possibly could. I was disappointed that the focus was on my trip and not on the purpose of NHMRC coming together and the fantastic research work that's been done. No one zoomed in for that. You can't really honour people for their fantastic research without being there in person, as was Minister Hunt, as were many other Victorians, in order to honour those researchers who frankly have been through probably the toughest 12 months of trying to do research with all of the restrictions in Victoria in particular.
Oh, so it was really important you had to be there. Like it's important for people to be able to go to funerals, or important for people to be able to go to weddings, or important for kids to go to school. People don't trust these people anymore. We don't trust the Emperor in Western Australia, who had a system that the police were able to drive a Mack truck through and were completely unapologetic for it. Let alone the system in Victoria that, as I said, rules about brothels, rules for everyone else, rules for regional Victoria when the problems were only in a suburban bit of Melbourne. People don't trust these people anymore because one rule for them, one rule for you, and if you break that rule, the cops will knock on the door of your house in Victoria. He was fine with the system where the police were going after people who wrote things on Facebook. Oh yeah, and by the way, Brett Sutton was supposed to go before a parliamentary inquiry in the upper house in Victoria, where presumably they would ask him things like, why are there double standards when it comes to things like dance schools and brothels? Why did kids not have to go to school for 2 weeks for the Delta Force strain that produced fewer cases than even happened on the northern beaches in Sydney when it was the Predator strain, or whatever we called it at the end of last year? But the health minister stepped in and said it would be inappropriate for him to give evidence. Why? Because he would have to answer questions? Or because he's not able to answer those questions? Well, does that surprise you? One rule for them, one rule for everyone else. But then, of course, the COVID Goldilocks playbook, the PR playbook, is being played in lots of different places around the country. Now, New South Wales is generally speaking the gold standard, but the fool's gold standard is the health hazard minister, Brad Hazzard in New South Wales, the guy who, after he never lost his job over the Ruby Princess failure, set the standard for accountability, or herein lack thereof, for the best part of 12 months. Well, as you know, there have been a couple of cases that have popped up in New South Wales, and they are very concerning. So he consulted page 1265 of the PR playbook, and it's time to scare people with references to 80s action movies.
This particular Delta virus is a near and present danger.
Oh, Tom Clancy and Chuck Norris. It's really serious. Now, remember, there was, of course, the emerging COVID emergency in Queensland, where the couple decided to drive their way from Melbourne through regional New South Wales into the Sunshine Coast, resulting in a grand total of 2 people being infected, and they were both the people in the car. Well, then we hear that there might be another reason for concern out of Queensland, because today, 1 new case. There's 450 in New York.
Really need people who were at those venues for these specific periods of time to go home and then get tested. That's really, really important.
See, here's the thing. I, like you, am tired of constantly talking about COVID. But no one holds these people to account. They just keep changing the rules. They keep consulting the PR playbook to scare you on the way in, to cover things up on the way out. And when you're way out of trouble, just keep announcing things getting better, despite the fact that, of course, there's no scientific reason for them to be being held back at all. Apparently there's a meeting of all the premiers tomorrow. I would really like if we could at least get out of that meeting a basic understanding of all of those premiers, where the Prime Minister has been for more than a year. If you're going to do these stupid lockdowns, can we make sure that kids don't get affected anymore? The science is very clear. Thanks for keeping us safe. But there's no need to shut down schools when it comes to lockdowns. Meantime, interesting polling came out today. It's kind of fringe polling group, but still. Interesting polling about people's attitudes towards hotel quarantine, whether it's the system that works and whether it's under too much pressure or not enough pressure. Put simply, when asked, should less people be going into the system, therefore fewer people returning to the country, therefore to not have problems with hotel quarantine when it can leak? Well, 36% of people say that's the case. Remember, about 180,000 people have gone through the system in New South Wales for very few problems there, so about 19% of people say that it's right. 7% of people think we should have more people coming in through hotel quarantine, which of course would produce leaks, as it has, 3 times now in Victoria. And 30% of people believe that there should be new, specific, standalone quarantine places that, like the one in Victoria, will cost $200 million, and then when the pandemic is over, will be used for what exactly? The most interesting number in there is the one that we haven't put up on the screen, which is 9% of people. And yes, I know that adds up to 101, but that's their rounding error. And 9% of people, well, they haven't decided. So you can imagine if even half of those people fell into any one of those other big categories, it would shift the politics. So for those that wish to shift the politics, watch for them to double down on their messages that the system is completely okay or completely needs a refurb, because they think that they can get numbers moving there, the best part of 10% of people who apparently are up for grabs.